The broadcast is now starting. All attendees are in listen-only mode.
Hello, this is Sharon from Genetic Alliance. We're just getting situated and we'll get started in a couple minutes. Thank you. Good afternoon. My name is Sharon Romalchuk, and I'm the Program Manager for the National Genetics Education and Consumer Network. This is a program led by Genetic Alliance. Our projects are centered around creating a network of partnerships and tools with the ultimate goal of improving access to genetic services, information about services, and also the quality of those services. And as will be demonstrated in this webinar, social media can be a great way to reach and engage individuals and professionals, especially for many of your genetics-related programs. And this webinar is an activity of the NGECN, which is part of the National Coordinating Center for Regional Genetic Services Collaborative and is funded by the Health Resources and Services Administration. So we're excited to have 3 presenters today to share their lessons learned using social media to reach specific patient populations, implementing a social media outreach plan, and demonstrating the reach and impact of social media efforts. Your lines are muted, so if you have a question, please type it into the question box on the webinar panel. And if you have questions throughout the presentation, please send those, as we'll be fielding questions as they come in for the presenters. I'll introduce Mark, the first speaker for today, and pass it over to him to get started. Mark Petruniak serves as the new media coordinator at Genetic Alliance. As new media coordinator, Mark contributes to web development and graphic design, takes charge of social media, and leads Genetic Alliance's video production. In his spare time, he's a web and social media consultant and has had documentaries featured at the San Francisco Ocean Film Festival and the Puerto Rico International Film Festival. So thanks, Mark, and we'll get started.
Cool. Hello, everyone. So, as Sharon briefly explained, I am the new media coordinator at Genetic Alliance, and part of my role is to set up systems and manage all of our social media tools and mediums, how they interact with each other. And the following few slides, and I'll go ahead here and get started. Okay, so I'll just share kind of a general overview of the popular tools that I use here at Genetic Alliance, and some of the more popular tools that everyone uses. This includes Facebook, and I'm sure you guys are all familiar with them. I'm not sure at the level of which you guys have used them, but I'm sure you all have heard of them. Facebook, Twitter, YouTube, LinkedIn, and Pinterest. Excuse me. So I'm just gonna, let me go back to so I just want to kind of give a general overview of each one of these tools. They've in the last year, and I've titled this presentation Social Media and Web 2.0 because Web 2.0 really set the stage of internet use and social media, not just for a way for receiving information and for reading news, but a way for also interacting with each other building relationships, and in turn, a lot of small organizations, small businesses, and initiatives around the world have used this power to connect and to talk with people and to really build relationships and find new audiences to promote their brand and to promote campaigns and mission statements. Some of the more popular ones are, political, with the Obama was one of the first to use social media. At Genetic Alliance, we've, segmented a lot of disease advocacy organizations and people on a location basis to make sure that we're reaching and hitting people that, want the information that we have and are going to be interested, and we can build our own network as well. So just kind of a general overview. Facebook just reached 845 million users worldwide, which is completely unprecedented. As you all know, it's good for finding new audiences, connecting with friends and close ones, jump-starting campaigns, and really being creative. And I'll get into some of the minutiae about how to do that in one of the following slides. Twitter, for those who don't know, is an online social networking tool. It's a micro-blogging service that sends tweets that are essentially just 140 characters, 140-character pushes that you can send via your network and through other networks. Twitter is really valuable for 5 reasons, really, that I've seen over the last few years. You can meet people from all over the world that might be interested in your cause. It has the power to search those people out. You can see many opinions from a specific subject all at once. You can follow other campaigns, causes, conferences in real time. You can get real-time advice on some of the questions that you have and feedback on websites and other tools. And it's also a great way to promote traffic to your website and tools. Moving along, YouTube, as you'll know, I have an experience in video production, and I love creating videos, so this is something that I always kind of incorporate in the projects that I work on. But it's just such a powerful outlet for sharing unique video, and the audience is really what makes it unique. There's never been an audience that has had as much, there's never been a distinct video audience like YouTube has, which makes it very powerful. LinkedIn is targeted for people in professional occupancies. It's good for finding and connecting with groups and communities of distinct professionals in a specific field, a specific venue, a specific topic. And then Pinterest is just essentially pictures and graphics. If you have a campaign and you have strong visual imagery, you're going to want to use Pinterest. It's a good way to bridge and to find new people and connect with new people through the use of strong graphics, infographics, and pictures. And again, I'll get all into this in the next few slides. There we go. So before even starting about social media, and I understand that I can talk fast sometimes, so if anyone has any questions or wants me to slow down or repeat something, or if anything's unclear, just feel free to jump in, unmute yourself, or ask a question, and I'll be happy to slow down and go over anything, to go over any issues or anything that we need to go over. So now that I've kind of give you just a general overview of some of the biggest social media outlets, I think the first step is before starting, before just jumping in head first, the world of social media and Web 2.0 can get inundating, and a lot can come at you all at once. I think it's important to have your mission statement clearly defined, and that mission statement and purpose, which I wrote here, will directly impact the tools, medium, and structure of any social media effort or campaign. So, for Genetic Alliance, our mission statement through the years, one of them was transforming health through genetics. We had a very broad outreach plan, and we wanted to target health professionals, individuals, families, and communities. So, that was one of the things we used to target, who are we going to find, what type of people do we want to hit and connect with, and what type of, communities do we want to build out, so like citizen science and all of these different objectives and different projects that grew over the years. We kind of adapted our social media strategy and outreach plan and what tools we used just based on where the direction that we were headed, the mission statement, and what kind of people we wanted to see our types of stuff. You don't have to use every social media platform. There are hundreds of them. This is an incredibly innovative field. I would suggest instead start where your customers are, the people that you want to impact are, and where you have the most fun. If some people are excellent tweeters and can shave down these really complex subject matters and blog posts into 140 characters, and they can be extremely effective, and they can be viral and intersect tons of communities because people enjoy doing that. Likewise, I enjoy creating videos, so our YouTube presence and different video outreach mechanisms can be equally effective as well. So really, think about who your audience is, who you want to impact, and then what tools do you think you can leverage the best to kind of bridge your mission and your audience together. And when creating content, something that I found in my time doing this is to strike a balance. And usually when we start, or in the past we started new campaigns, or I've seen other organizations and campaigns start, and it's just one track, all promotion, or one track, all updates of a certain specific subject matter. I think the key really is to strike a balance with what you post. Again, what's the mission of your business will directly inform the question, why are you using, sorry about that, why are you using social media? And I don't advise to push people to your site or products 100% of the time. Again, in this Web 2.0 world, when we're talking and we're building conversations, we don't want the conversation to just be one way. We want to ask, we want to have feedback, we want to comment on, other sites, other products, other sources of information, other things that people are doing, and then in turn, those efforts will be reciprocated. And this is how your brand and the trust and kind of your overall presence within whatever sites and platforms you're using will be built out over time. Yes, so typically I like to break up just kind of the outreach and the content that I give into thirds. Whether I'm using Facebook on a Facebook page, or if I'm tweeting, I like to divvy things up in thirds. 1/3 promotion, some of the events and some of the webinars, the conferences, and then within the organization, some of the things that we're excited to be doing. I like to balance that with news and timely updates about what's going on in the community, what's going on in the world surrounding a specific topic, and of course, I'd want to make sure that those news and timely updates are in line with what our audience and what our mission statement and what the people that they're targeting want to hear. And then finally, conversations and relationship building. If someone retweets someone, I might thank them for retweeting a tweet. If someone has an interesting post, I might ask a question, or I might comment, or I might give them direct feedback on the quote. So this is really how I think from an eagle's perspective, from a bird's eye view, how I structure and how I think about social media, even before starting and getting into kind of the weeds. And I think that, as we'll go on, we'll hear about, what other regional collaboratives have been doing, and how, I think it's always a tricky issue, and it's always up to the preference of the organization or individual managing social media. But I've always been a fan of using third-party management, either through TweetDeck, which is a popular application for Twitter, or through a slightly more powerful application called Hootsuite that we currently use that makes organizing, all of this content
That's the numbers I sent.
a lot easier. So
there's a different phone number.
I recommend you to check out, what do we have?
You can get online, but you cannot call in at that other number.
Yeah, so I recommend everyone to check out Hootsuite. It's an incredibly powerful third-party software that in the two pictures you can see, you can categorize streams, and you can post to multiple channels. You can post to LinkedIn, Facebook, Twitter, and everywhere in between, and you can really plan out an outreach strategy that's suitable to what you want to achieve. You can also search users. You can search different keywords and topics of things that might interest you in a further effort to kind of explore and figure out what's going on within these worlds that you want to be engaging in. And I think I'll just sum this up with 10 bullet points, really, or key nuggets of information that I think if any of you were to walk away from this presentation, these are important to know. Just some bits of information that I think everyone, whether you're a small business, whether you're a family member, or you're an individual, I think it would be really worthwhile to know and to apply to whatever strategy, campaign, or effort that you're trying to build out. The first is that social media is social, and I've talked about this before. It's about interaction and not just broadcasting and promotions. You should be having conversations. You should be finding new people, and you should really be utilizing these tools to generate interest in your products and also to generate your own interest in what other people are doing in the world. Second, you can't outsource a relationship. It's really hard, and I feel like people go through you know, the gears, and like social media can over time become an A plus B equals C, but it's not. It's about cultivating this relationship. And if you want, you know, help with developing your campaigns, think about having someone else schedule your content so you can look it over. But deal with replies yourself and try to keep the content consistent. And it's as if you were using your own voice. So if you're going to have people work on the social media stuff, whether it be an intern or a colleague or or someone else, just make sure that that person knows the ins and outs, sees examples, and can talk within that same voice and have that same the same feeling that you built the strategy or campaign with. Number three, it's not magic. Don't think that just by having a really good Facebook page and a really succinct Twitter page and awesome YouTube videos that all your marketing problems will be fixed overnight. Social media is more of a marathon, not a sprint. It needs time to be sustained, and this happens over time and over constant, a consistency of creativity and hitting the right people and promoting yourself effectively. As you sort of have to get into the groove. Pick your channels. Again, you don't have to use all the social media platforms because there are hundreds of them. Start where your customers are, have the most fun. This will be easier for you and more effective in the long term for your marketing efforts. 5, do one thing at a time. Don't feel like you have to launch 3 different social accounts at the same time. You have to manage them, connect them. It's more important just to start by picking one, get really used to that, slowly build, add another. I'd recommend starting with Facebook. It's probably the easiest. It's really user-friendly, it's intuitive, and most of you are probably using it on a personal level. This is a good thing to start by either building a fan page, an organization page, or just kind of poking around, doing some research at how you can be most effective at that one tool. Vary your posts. Don't just post one sort of thing. Like I said before, I typically divide the social media stuff into thirds. And then also it's important to mix it up with images, videos, text, share other people's links, sharing your own stuff, having conversations. If you find a blog post that is really awesome and informative, share it via your social media channels, and mention the person that you're sharing it from so, you can have a conversation. Again, it's all about connecting, building, sharing, and having these conversations that can ultimately benefit everyone in the community. You can lead with social media, but it doesn't work on its own. And this is, in part to another point, that this should be part of your marketing toolkit. I think it's always been effective for us. We've utilized listservs, and we utilize email pretty heavily. And I think that the combination between social media and email is something that shouldn't be overlooked. And I think that if we can connect social media to everything, putting it on our website, putting it on our business cards, putting it within our emails and all of that, if it can have a strong brand presence, wrapped in the bigger marketing plan or the bigger objective of an organization, I think a constant and sustained face that exists and is evident, within whatever outreach plan you're doing will always set you up for success. Again, I talked about it a little bit. Email, people share emails, they forward emails to a friend. I would encourage people to share emails and reach out and to have have Facebook links and Facebook posts always be part of any outreach or email or whatever tools that you have. 9 is keep learning. This stuff is constantly evolving, constantly updating. There's incredible amounts of innovation going on within Silicon Valley and Facebook and YouTube. In fact, the YouTube channels have just updated themselves, and there's a whole new interface for organizing content and creating your channels, and this has just been rolling out over the past few weeks. There's always going to be stuff to learn, and there's always going to be ways to grow. But the varying content and some of the key lessons that I talked about before will stay true. It's just important to make sure that you're leveraging the technology and that any updates that they come out with you can click on, because there might be new and easy ways to either find contacts via your email, new ways to brand stuff, and that's always something you never want to miss out on. And then finally, let go. With social media, it's not all in front of you. You can be creative. You're going to try your best, but ultimately, you don't have control. And many business owners are afraid of social media because they worry about competitors, disgruntled clients, saying negative things about them. But really, anything could happen, and you'll never know how people will react unless you put your information out there. You're genuine. So I would say do what you enjoy, jump in, relax, and being a part of the conversation and whatever conversations that you're able to sustain and foster is always better, in my opinion, than being left out. So jump in, and don't be too scared to get your feet wet. And I just want to end off with some funny quotes. There's not funny, but good quotes that I've found over the years. Positive networks built on cooperation and altruism tend to thrive, while negative ones tend to dissolve. Be positive. It's easy to be a critic, but ultimately people like hearing positive things. And this goes on. Some of the common criticisms of social media, that it's tiring to hear what people are eating for breakfast, or like stuff that doesn't really matter. Make sure you're posting something with sustenance. Apparently evolution favors behaviors that cause us to disconnect from mean or annoying people. So yeah, that's pretty much. I just wanted to give a general, some tips, some things that I learned before really starting. Just a general overview of the 5 major tools, Facebook, Twitter, LinkedIn, YouTube, and Pinterest. That we use. Also the third-party Hootsuite application that is incredibly valuable to us. If anyone has any questions, if anyone wants me to repeat anything or go more into detail about a specific social media outlet or a tactic or a tip, feel free to let me know, type in the questions, and I think we'll also be taking questions at the end of all the presentations. So thanks everyone for listening. Again, my name is Mark Ruchiniak. I'm the new media coordinator here at Genetic Alliance. You can find my email on the About Me section of the Genetic Alliance website.
Great. Well, thank you so much, Mark. That was a great presentation. And I want to remind you, if you have any questions for Mark, you can send those in and we'll answer those now, or we can answer them at the end. Oh, we have a question for Mark. And the question is, how do you determine who to accept on your social media sites, such as Facebook?
Yeah, so this is a good question, and you can see more and more now as social media sites are getting popular. You can get you get a deluge of people asking to be a part of your fan site. What I would do is I would typically click on that person before I accept them, and then what Facebook does, they give you a number of how many friends that they have, how many mutual friends that you have. So typically, if I click on someone and they have maybe 400, 500 friends, and 26 of those friends are in common, and I can click on them and I can say, oh look, I have 14 of these friends. I met at a conference at AmChip, or these are of a scientific community, and then that would check out. So I would accept that person. And then you can also set up your Facebook page and other mediums to have, have a custom welcome message like welcome, thank you for joining, or thank you for liking the Genetic Alliance Facebook page. We'll give you updates and feel free to contact, X, Y, and Z. But other times if someone, asks to be a fan or a friend and they have, 0 friends or 10 friends and no one's in common and it's a strange picture and it just doesn't feel right, I'll typically ignore them. But I tend to, if someone has a lot of friends and they're interested, having a lot of friends and mutual friends isn't the deciding factor. It's really how I'm feeling, if that person's genuine, if that person's real. Typically if they have like 0 friends, not many mutual contacts, and you don't feel right about it, then I would just ignore. But this is usually on a case-by-case basis.
Great. And one more question, and then we'll have to move on and ask questions at the end. Can you discuss the data report that Facebook provides and how to use that to improve our use of Facebook for our organization?
Yeah, sure. So one of the great things about Facebook, one of my favorite updates that they made over the past year was that they included analytics for free on your business pages. And what that does is it gives you a metric of your reach. I've seen over time that there is a direct correlation to paying for promotion. So it depends. Let me back up there. So it depends really, again, it's on a case-by-case basis about what we're going to promote. If we know we're going to promote a popular story, the Supreme Court just passed something, and we know a lot of people are going to be interested in it. We're going to target, 3 or 4 organizations, and then we're going to schedule that out, and we're going to plan this for the next week, maybe 3 or 4 posts a day, and be talking to each person in between. During that time and during that campaign, I would be monitoring what's going on in the Facebook analytics section for free and how my reach is increasing and decreasing, and how many people are paying attention to the actual posts, whether it be male or female, what time of day, and stuff like that. I would suggest to all of you to go into the Facebook analytics and check out, the reach statistics and all the other different demographics, because I think that, afterwards, just having a written copy of that or analyzing that and using that can be really effective, knowing that, you hit maybe 70% of females at, like after work hours. So you know that people are going to be engaging after work, or people are going to be engaging before. And really, you can mine that pretty well and have a targeted campaign for next time. Also, I'm a fan of using the Facebook pay for promotion stuff. You only pay for what promotion you get. So if I pay $15, they won't charge me the $15 until I got $15 worth of clicks and posts, and more times than not, you'll see significant reach and significant more promotion impact using that feature as well.
Okay, great. Well, thank you, Mark. And now I'd like to pass it over to our next presenter. Christy Weiss is the social media coordinator for the Mountain States Genetics Regional Collaborative. She is the mother of 2 kids. Her daughter has a suspected mitochondrial condition, and she serves on the Mountain States Consumer Advocacy Work Group and was a member of Baby's First Test here at Genetic Alliance, their 2012 Consumer Task Force. And she also created a blog, so she'll talk a little bit about that. But she uses that to educate and spread awareness about metabolic conditions, the food we eat, and how environment impacts health. So, Christy, are you there?
I'm here. Can you hear me?
Yes.
Great. Thank you, Sharon. And thank you for inviting me to present today. So as Sharon said, I serve as a social media coordinator for Mountain States Genetics Regional Collaborative. And I was hired last year in October to help set up a Facebook page. Next slide. So at Mountain States, we were following Mark's advice and picking one thing, and we chose to start off with Facebook. And we're utilizing Facebook to spread the word about not only what the work that Mountain States is doing, but also resources and sharing resources and connecting with others in the social media world of genetics. Next slide. So our first challenge after making the Facebook page in February, we launched our page on February 8th of 2013, was to get people to like our page on Facebook. So we strategically launched our page right before our annual meeting, in-person meeting in Phoenix, Arizona. And then at the meeting, we encouraged Mountain States meeting attendees to like the page. They were reminded almost every session about liking our page. We told them there were two ways they could find us. They could go into the search bar of their Facebook application and type in Mountain States Genetics Regional Collaborative, or they could just add a / at the end of the Facebook web address and type in our web address, which is mountainstatesgenetics.org. And so after we had a goal of reaching 100 likes after that meeting, which we did just shortly after that, and we've made this little picture graphic to celebrate that milestone. Next slide. So our second challenge after we started building a fan base or a like base was to get individuals to share the content that we were putting out daily on Facebook. So we have found, as Mark mentioned, that sharing posts from our Facebook pages increases exponentially the reach that we have collectively as a collaborative. You can think of it as sharing posts informs your friends, colleagues, acquaintances of things that you find important. It increases their awareness of your interest. And so an example for our collaborative would be if you have an interest in genetics or newborn screening and you share that content that we are posting on our Facebook page with your audience, you're spreading awareness about those topics to the audience that you influence. Next page. So if you're not familiar with the term sharing or the concept of sharing on Facebook, I thought I would give just an example of how it works. At our meeting in Phoenix, Arizona, the Texas Pulse Oximetry Project was presented by Dr. Gong and Dr. Gilroy, two doctors from Texas. And they showed a video as part of their presentation. Once the video was finalized, they sent us the link to it, and we posted it on our Mountain States Genetics Regional Collaborative Facebook page after the meeting. The video itself was then shared. If you can see in the bottom right-hand corner, there's a little piece of paper with the corner turned over and the number 16. That's the number of times this video was shared as a result of us posting it on our page. So though at the time we only had about 100 people liking our page, our reach was nearly 1,000 people reached with this video. And we were able to look on the YouTube site where the video is housed and see an increase in people who actually watched the video as well. So people weren't just clicking on it, they were actually watching it as well. So this is an example how putting something one place can reach quite a number more people than just the people that are liking your page. Next page. And just a little primer, again, if you're not familiar with sharing something on Facebook, it's really 3 easy steps. Step 1, you just click that share button that's next to the like comment words down at the bottom of the post. Text box will pop up in step 2, and there's a place for you to write something, just a reason why someone should watch or read what you've posted. And the third step is very easily to click the blue Share Link button at the bottom of that pop-up box. And that will place this video and what you had to say about it on your timeline or your Facebook page. Next slide. Something else that we've done at Mountain States Genetics Regional Collaborative to help highlight some of the internal things that have been going on is what we call Work Group Wednesdays. Since the format of our collaborative is set up in distinct work groups with distinct focuses, we have done this Work Group Wednesday on our Facebook page to not only highlight what's going on in our work groups, but also to highlight resources such as links, videos, white paper, websites that exemplify the mission of each work group. So this example is for our emergency preparedness work group, and we shared a link at this particular one in July of a coloring book for kids. It was a free downloadable coloring book for emergency preparedness, and it was free at the ready.gov site. And so we tried to make add things here that are either going on in our work groups or something that would benefit the members of that work group and the audience that they influence. Next slide. Something else that we're doing, we're taking a little break from Work Group Wednesdays during the month of September because we're celebrating Newborn Screening Awareness Month and the 50th anniversary of newborn screening. So what we're doing is each day we're posting what I'd like to call an info pic. It's really a picture that I made up in PowerPoint, a PowerPoint slide that has information on it that we want to share. We're including facts about newborn screening to highlight and celebrate the 50th anniversary. This one here shows, for example, what medical conditions are screened for in a blood spot. And each day last week, we highlighted a different type of condition that is screened for by blood. This has been a great way to connect with patients and family groups. For instance, you can see in the comment section there, I thank the Fatty Acid Oxidation Support Group for the information on the slide. And they, in turn, then shared this with their group when they were tagged in it. And they also, some of them liked our page. So it was a great way to increase that communication between the two groups and then also share information with the groups, with the people that they influence. Next slide. So Mark did a great introduction to REACH and statistics, and the great question was asked. And this is just an example of our page 6 statistics since the beginning of Newborn Screening Month. You can see right there, right before this purple dot on September 4th, was the beginning of when we started posting our newborn screening awareness info pics. And you can see that we've had an upward trend in our total reach, and we hope this will continue as we continue to post throughout the rest of the month with information that we hope others will find interesting and something that they will want to share with others. Next slide. So as Sharon mentioned, I do have a couple other hats that I wear in addition to the social media coordinator position. I have a blog called Baby Food Steps. It can be found at www.babyfoodsteps.com. I write about all different things, but specifically about taking small steps each and every day to a happier, healthier family while we're navigating the twists and turns of the metabolic mitochondrial disorder that my daughter is suspected of having. And this week you'll find there a lot of information about mitochondrial disease, since it is Mitochondrial Disease Awareness Week, correlates with Newborn Screening Awareness Month. So I've been doing a lot of posts there about what we've learned over the last couple of years about mitochondrial disease. In addition, last year I was part of the Baby's First Test Consumer Task Force, and it was a wonderful experience. I learned so much about newborn screening advocacy and the use of social media to reach a wider audience. And I need to thank Genetic Alliance and Mark for his training in social media and for this opportunity to get involved in the newborn screening advocacy arena. Next slide. So I just want to wrap up by saying, are you looking for ways to collaborate and cross-promote your message? If so, if there's something that you would like us to help you share, and in turn we can share some of, you can share some of our content as well. We're always looking to collaborate at Mountain States Genetics Regional Collaborative. Most of our posts for Mountain States are centered around common themes, and those include genetics, newborn screening, medical home, telegenetics, consumer advocacy, emergency preparedness, and health information technologies. Ironically, those are the titles of our work groups as well, because we do try to focus on the things that our collaborative and our work groups are focusing on. But really anything that fits in the genetics arena with outreach to those in need of genetic services, we are always willing to talk about and see how we can collaborate to get the message out to a wider audience. I have my contact information there. You can contact me at kweese@mountainstatesgenetics.org, or all my contact information is on the contact tab of the mountainstatesgenetics.org website. If you have any questions, I'd be happy to answer them, and always available to look for ways that we can collaborate further. Thank you, Sharon.
Great. Thank you so much, Christy. And it doesn't look like we have any questions right now, but if you have them, continue to send them in, please. I think we'll transition to The next presenter, Ann Crotty, serves as a program manager at the Iowa Child Health Specialties Clinic, which is Iowa's Title V agency. Ann was the project coordinator for a pilot program funded by the Heartland Regional Genetics and Newborn Screening Collaborative, and it was designed to engage patients with specific conditions through social media. The project, entitled Real-Time Family Support Through Social Media, was a year-long initiative lasting from May 2011 through May 2012, and she'll share much more about that now. Ann?
With special health care needs. We serve through age 21 in Iowa, and we have a system of care that with 4 equal components. There's direct clinical services for children when the services aren't available otherwise in their community. We provide care coordination, family support through a network of over 40 family navigators who are parents of children with special health care needs themselves, and also infrastructure building to help the system work better together. So the idea for this project came about through the realization that genetic conditions are very stressful for families, and that manifests in a whole bunch of different ways through financial concerns for other children that don't have special health care needs, the feeling that some parents aren't able to devote the time needed to take care of those other children because they're caring for their child with special health care needs. And then we also knew that with rare conditions in rural areas like Iowa is, that a lot of times families wouldn't have the opportunity to meet each other with similar conditions. So we wanted to have a virtual medium that would allow them to do so. So next slide, please. And the next one. Okay, and the next. Okay. So the inclusion criteria that we decided on, we picked out 6 conditions, and we wanted to create family support groups on Facebook for families with each of these. And we chose these conditions based on prevalence, the need and interest among the community with these conditions, and then also how severe we thought it was and influence on daily life. So next slide. So we created a Facebook group for each of these conditions, and I have to mention the difference between a Facebook page and a Facebook group. So our last 2 speakers, I think we're talking about Facebook pages, which are more public, a little bit more professional, I would say. But we wanted to create groups because the goal of our project was to create this interaction between families, not just interaction with the agency and on posts, but also like actual friendships. And that's exactly what we had developed, was relationships between families. So we wanted to connect families, and then we also shared health information in plain language and advocacy alerts, and we shared other groups' posts like Mark recommended with a whole variety of types of content, from videos and petitions and stuff like that. So next slide, please. So I was the project manager on this, and we were really careful, I would say, about privacy issues because the University of Iowa, where I'm based at the time, had some fairly restrictive rules and thoughts on social media. They were really nervous about any content that might go outside of this group, even though it was entirely cut off from healthcare providers. There were no healthcare providers in our group that were posting, and all the patients were joining on their own choice. So it was not connected at all. The only connection to the University of Iowa was me, who was managing these groups and overseeing it. So the Facebook groups allowed a little bit more privacy to members, and it was a closed group, which meant that you had to be approved by the organizer to join and see content, and I was the person that was approving it. It did get a little bit difficult at times to determine who was appropriate to join and who wasn't. Because of our short time frame, we only had probably 9 months of actual contact with families, and we knew that with long wait times and patient appointments, when they might not come in only once a year, we might not reach all families. So it was just open, available on Facebook to apply to join. So next slide. Oh, there it is. Can you go back, please? Oh. Okay, so the other thing that I forgot to mention about Facebook groups was that it allowed more interaction between families who were posting, but it also made data collection a little bit more difficult. So those really nice graphs that Christy had and that Mark was talking about with analytics, turns out I found that those were not available through Facebook groups. They were on pages, but I had to do everything by hand. And I suspect that they might have changed that, made it a little bit more easier, or a little bit easier now that they redid it last year, I believe. So, next slide, please. We also considered using Twitter, but ultimately decided to, for the most part, to stick with Facebook. And I think there might be some more text coming up if you click it again. There you go. So although we didn't use Twitter to contact families, we did use it to promote our Facebook groups. So we developed a handle, and then we tweeted our Facebook group links, and then the hashtags quite a bit. So we use hashtags to group content, so it would show up as content when other people were talking about, say, PKU. You would get this information about a Facebook group for Iowa about PKU. And then that was another instance where our supervisors in social media were really concerned about privacy and the potential negative consequences. So we just decided to be satisfied with a little progress on Facebook, and that was okay. It worked out for us. So, next slide, please. Okay, so we worked, as I mentioned before, we worked with 6 organizations, and some of those organizations, some of the conditions already had an organization behind it, such as the Heartland chapter of the National Marfan Foundation, which was a local statewide group on Marfan's syndrome. But that organization had to go by the guidelines of their national board. And they also had local guidelines that all the posts had to be satisfied to meet. So it kind of involved a lot of red tape in that area, but it was good to know about once we identified those areas so we could get things done. In another instance, we had a healthcare provider who, she had seemed a little bit resistant. And I mean, she seemed totally okay with it, but she just seemed to not be returning my phone calls, and she was very pleasant and stuff otherwise. But it turned out this was after the bulk of the work was done, and I found out later that she was not supportive of social media in the first place, and so she had kind of been framing it, this program, in a way that would not necessarily encourage families to join. So that would have been helpful to know early on so that I could have done more one-on-one work with her to make her feel more comfortable with it. We did do some training with healthcare providers early on, but she was just really, really skeptical, which she acknowledged later on after the fact. We also noticed that there was a lot of fragmented care within our own hospital system between the genetics department and other specialty areas. But it did help to have national organizations on board that could kind of help families navigate the system between one area of the hospital and another area. And like the Ehlers-Danlos National Foundation got really good about knowing that there's a group like this and referring families to our groups when they would post on their national site. We also had a parent that initiated a Williams syndrome group that was very similar to ours. So even though it wasn't technically associated with our program, she wanted to start something very similar up, and we were totally supportive of that. Something else that also came out of this was the realization that we need to expand our telehealth offerings. So we had a family out in western Iowa that wanted to get back into attending appointments at the university, which was maybe 3.5 hours away. And we have a clinic in their town, but they would, I mean, the only other option for them was to come to Iowa City, which is 3.5 hours away, and it just didn't make sense for them to have to do that when there's a perfectly willing and able clinic to do that right there in their hometown, when it would be a 6.5 hour round trip for them otherwise. And we currently use telehealth to provide some services via webcam. And the practitioner in this case had said that it would probably just be a type of exam that would not have to be hands-on because she's already seen this child. It would just be a follow-up appointment. But the hiccup was that we did not have the billing procedures in place at that time. So they were able to see her at a regional clinic appointment it was maybe a 3-hour, 2.5 hour round trip. But we are working on a procedure to expand telehealth otherwise. And then the other thing is that we noticed there was a lot of parent interest in raising awareness, but sometimes they aren't, or they weren't really sure how to do so with that. So I was able to provide some guidance on how to do that. And so, next slide.
Hi, and this is Sharon. I'm sorry to cut you off. We are running out of time, so if you could finish up so we can ask a few questions.
Sure. So the activity level of and type of activities varied by the group. like with the Ehlers-Danlos syndrome, there was a lot of interaction. I think part of that is because there was a perceived unmet need among families, so it grew very quickly. There are some perceived unmet needs among other groups as well, but they just didn't take off as well. Next slide. The PKU group is another example. That was a little slower to take off. Other results included, we had a lot of emotional support discussed, policy discussions, symptoms. There was the desire for youth to join and Skype with each other even. We also decided that children with sickle cell disease, in this case, might have needed more support and intensive services and alternative marketing because they lacked significant resources beyond just the internet access and access to health care. So next slide. For sustainability, we wanted to approach Family to Family Iowa, which is a statewide network of family navigators, but they were not able to manage at that point. So we asked 3 or 4 members of each group to take over as moderators, and we gave them some tools to assess the content for reliability and accuracy and how to build relationships among group members. We kept the same posting guidelines, and that's been working out well so far. Next slide. So we didn't ask healthcare providers to monitor the content, although we thought about it because we thought there might be potential HIPAA violations. We knew that they were short on time already. And then we also thought some families might take advantage of the provider's generosity and expertise and use that as a replacement for a medical visit, which is something we didn't want to get into. Next slide. For evaluation, we did a survey and a focus group. Next slide. Families were very appreciative and accepting of minor mistakes. They said that the definition of a friend has changed from someone that's in person to someone that maybe you've never even met before, and that even if someone is, say, a teenager and you don't discuss the condition, you have a background of understanding that's really helpful. Next slide. Okay, any questions for either of us?
Great. Well, thank you so much, Anne. And I guess we probably don't have too much time to take questions, but we will field your questions that you send in to the presenters, and we encourage you to reach out to the presenters. So I would just ask quickly if any of the presenters have any summary notes or anything that they'd like to close by saying. Mark?
I mean, no, other than that, I think that we all understand that social media is changing, but there are just some core values like, diversifying your content and, taking things on a case-by-case basis and kind of catering to the audiences that you, are looking to impact and connect with. Each organization and family will eventually establish their own voice and their own voices. So it's a fun and exciting field to be in, and just concentrate on whatever tool, whatever medium you like doing the most, and what is the most fun for you.
Christy or Anne, anything?
I'm here. This is Christy. I would just say you'll never know until you try. So if your organization is wondering whether you should get into social media or not, I would say just try it and see how it goes. It's not an all or nothing thing, and so I found it to be greatly helpful from a personal level and a professional level. And I think connect with somebody that has some expertise to get you started, and then go from there.
Okay, well, I just want to thank the presenters, and I hope that this was a helpful presentation for you and that you can see how using social media could be very helpful to your programs. And please do send any questions you may have to myself. This is Sharon Romalchuk at Genetic Alliance, or to any of the presenters, and you will receive a follow-up email with, I know someone requested the slides. So thank you very much, and have a great day.
Thank you.
Thank you.